inviting Dr. Rajiv Sukumaran, who is the senior most tech-savvy ophthalmologist among us, who is already using AI in his practice. So he will be talking on the clinical applications of AI in ophthalmology.
Good afternoon, everybody. Nice to see a big crowd for AI. It's going to be one of my projects, and I'm very happy to see so many here in this hall. So if you look at the evolution of AI, first it started in 1950, it peaked and then came down, then it went up. Now it is a boom. It's a big explosion-like improvement. So if you look at the different levels of AI, it's the machine learning, it's just the pattern it learns. A deep learning is there. CNN is something like a cortex, different level of interpretation. First it analyzes the color, then the shape, and it goes on. And then you have the generative AI. That is, it will create its own database. That is one step higher. Then the chat box is there. So the large language models, what we have is the Google. You would have heard about ChatGPT 4. Now even 5 is just coming out. Gemini from Google, Microsoft, Meta, Llama from Facebook, and Chinese DeepSeek is doing wonders now. So if you look at AI in an ophthalmology, rise in AI is in healthcare. Ophthalmology is the image-driven specialty. So you've got a lot of images, can analyze and give you faster and more accurate diagnosis. So the diseases what we deal is the diabetic retinopathy, ARMD, glaucoma, ROP, cataract, and keratoconus. So why AI in diagnosis is that image-based detection, deep learning with fundus and OCT images, and early detection and disease grading. So AI in treatment also predicting disease progression over progression, personalized treatment, teleophthalmology, surgical planning using AI model, and robotic surgery it's coming into. The prominent AI models and system what we have now is the IDXDR. Then the Google Deep Mind, which is called the retinal disease detection, and iNuke, Reti AI, and Orbis International AI. So IDXDR is the first FDA-approved autonomous artificial intelligence model. It's a deep learning model, can diagnose diabetic retinopathy without human intervention, high sensitivity and specificity, specifically focused on more than mild diabetic retinopathy. So this is the integration of the AI into the OCT machine of Topcon. So Google Deep, now it is called the Google Health, AI-powered solution for various healthcare. They have the Streams app, which uses AI to predict patient deterioration and alert clinicians. This is not ophthalmology. In ophthalmology, the diagnosis and predicting retinal disease. The prominent one is the ARDA with Aravind Eye Care system. So Google and Aravind Eye Care developed and deployed AI algorithm for screening diabetic retinopathy and detecting early onset of blindness. ARDA means Autonomous Retinal Disease Assessment System. It's a CNN, that is deep learning, and further is CNN. So it is CE approved for AI learning. It started in 2017. Aravind provided a large database of retinal fundus photographs. That is the significance of the study, because they use their own data. The experts from them manually graded the images for diabetic retinopathy, which is used for their study. Enabled screening at scale in rural and semi-urban setting. Reduce burden on ophthalmologists by filtering non-critical cases. Improved early detection and reduce risk of vision loss from diabetes. So about 6 lakhs patients were screened till 2024. High sensitivity, 96 to 97. The significant point you have to note here is there was 8-fold increase in detection of treatable stage. That means we were missing 7 out of 8 when we did it manually. So look at the importance of AI. Caught 100% the patient with severe non-proliferative and proliferative diabetic retinopathy. Highlights risk of systemic events. That is, with looking at the fundus, you can predict whether the patient can go in for a cardiovascular events. This is yet another study. I'm not going into the depth of it. And these are some of the prominent AI models in ophthalmology. And these are the pictures using AI models. So Orbis, again, is a similar one with a high, they were focusing on ROP, diabetic retinopathy in kids. I mean, sorry, not ROP, it is diabetic retinopathy in kids living with diabetes. That is the type 1 diabetes. So future in AI in ophthalmology can be explainable AI. Multi-modal data integration like OCT, fundus picture, ICG, all those you can integrate it. Predictive modeling, you can predict by the progression, you can real-time monitoring, you can do AI in surgical planning, personalized medicine. So real-world integration summarizes you have about 100 visits for a patient, summarize the entire thing and give it to you. And diagnosis and other improve and image-based analysis for differential diagnosis. So this, if you give your data, the AI will tell you what probable diagnosis is it and whether you're missing any finding, all it will give. This is chat box from ChatGPT. And this, you give a picture, it will give you the diagnosis. Interpret. And this is yet another picture, it will give you diagnosis and it will even suggest what you have missed and what can be done further. This, I'm working on it. It is a fantastic one, especially people who are standalone, who don't have a second person to get an opinion. You use it as an intelligent assistant. It will not take away your profession. Just don't be carried away by that. And these are the future plans in EMR, what we are doing. The third one is what I'm working on, real-time voice detection and AI-based documentation. So you sit and talk with the patient, whatever the patient says, whatever the language, it will interpret, and in your EMR, it will start typing. Whatever, if he says, chorin, vedana, everything, it will come, itching, pain, like that. Then you can dictate the terms, what you want. Yes, the patient has got papillary reaction, automatically it will come into it. Okay. Even if they talk long, it will summarize and give you the, ultimately, they'll talk too much, then foreign body sensation, that's it. It will predict and tell you. Then personalized treatment recommendation based on AI models. So it will go through journals and tell you which is the best treatment for a particular patient. So prompt engineering, what I was talking about, personal respond on AI-trained ophthalmology consultant, as is securely by API. That is a little depth. I'm not going into that. And if you look at this study says we predict that impact of superhuman AI over the next decade will be enormous, exceeding that of industrial revolution. You have heard about industrial revolution, which changed the world entirely. Similarly, it's going to happen in the coming future. So AI is not intended to replace ophthalmologists, but rather to augment their capabilities, acting as a powerful assistant tool. AI will undoubtedly become an indispensable part of ophthalmic practice. Take it from me, the youngsters, in the next 10 years, if you don't learn AI, you'll be out of this profession. That is for sure. So don't look at, I'm sorry for this picture, don't look at AI like this, look at it in a proper way. Okay, understood. Sorry for the picture, okay, but it gives a lot of meaning. Okay, thank you. Did I stop?
Thank you so much, Dr. Rajiv, for introducing the clinical efficiency with which AI can work and the various, whatever is possible in our practice, be it in healthcare delivery or in clinical diagnosis. Now we will go to the next talk. Thank you so much. He's busy and he